An advocacy group defending the rights of temporary foreign workers is asking the provincial government to improve their access to public health insurance. It comes following the case of a Guatemalan worker who got diagnosed with blood cancer. His coverage and his right to stay in Canada expired before a critical stage of his treatment. He was granted an extension of his health insurance at the last minute. Carlos Adolfo Bocel Miculax was working at a Lanaudière potato field when he got diagnosed with blood cancer. He started his treatment in the fall, but right before an important procedure, his health insurance expired on December 11th.
Guatemala, así como estoy yo, casi que es ir a esperar la muerte allá.
Going back to Guatemala in my current state is like waiting for death, he says, because the treatment costs are too expensive for him and far away from his village. The hematologist who's treating Miculax wrote a letter to the cabinet of then Health Minister Christian Dubé to ask for a 6-month extension of his health insurance.
Question de dignité humaine.
A question of human dignity. We have a moral contract towards them, considering they are taking jobs Quebecers don't want or can do, he says. Independent MNA Vincent Marissal also intervened. We went back and forth to Dubé's cabinet, says Marissal, to get an exemption that was finally granted. I cried with emotion and joy. An advocacy group promoting the rights of seasonal workers is calling on the federal but also the provincial government to intervene because this isn't a unique case.
En ce moment, c'est pas un programme, c'est une mesure d'exception. Donc nous, on veut que ça soit une mesure un peu plus accessible.
We need a more accessible measure that medical teams are aware of because some hospitals could refuse to treat those workers, she says. Jean Roy agrees. With an increase of temporary workers in the province, he believes that we could see Miculax's case occur more often.